Welcome, listeners, to a brand new episode of The Spirit of Hagyard. You are in for a treat today. I am your host, Jody Lynch Findley, and we are going to take you on a little bit of a different journey today. As we pivot, you have experienced a great deal of our behind-the-scenes episodes where we have walked through the career journeys of so many of our incredible veterinarians and the Hagyard team members. Today, we are going to pivot and take you into a journey about the services that are available here at Hagyard Equine Medical. And specifically today, let's talk diagnostics. I have two incredible guests sitting here today. Now, one is a veteran Spirit of Hagyard guest. The other is brand new. And so let me introduce Dr. Michael Hoare. Dr. Hoare, you were a guest back in February of 2023 and talked to us all about thoroughbred sales and public auction. So if our listeners want to go back and learn more about you, they can go back in the files to February of 23. And welcome Dr. Matt Coleridge to the Spirit of Hagyard podcast. We're excited to have you.
Thank you. Excited to be here.
So, gentlemen, today, I'll be honest, this is not my area of expertise. So clearly you are here for a reason, because I can't teach our listeners a lot about diagnostics. And specifically, we want to talk about the mile pet imaging. So let's start at the beginning, because this is really exciting. I think that this is something that's available to your clients that is probably a little bit of a hidden secret. And we wanted to be able to share this opportunity not only with potential clients, but also to let our listeners know who are in a position to look for internships, externships, career opportunities, all that Hagyard has to offer. So if I start out and just ask you to introduce diagnostics in general, let's get our listeners up to speed on diagnostics at Hagyard, and then let's step into the mile pet imaging. Fair?
Sure.
Dr. Hoare, kick us off.
Well, when we're talking about diagnostic imaging in the racehorse, several modalities we're going to use, probably the primary one being radiographs. So if we're looking at lame racehorses or pre-purchase exams, a lot of it is based around radiographs. And then moving on, when we can't diagnose it from maybe blocks and radiographs, we start kind of getting into different modalities like nuclear scintigraphy, like the bone scan, or in the last couple of years we've been using PET scan and CT and MRI. But so we've loads of examples of maybe doing all modalities on the same horse, or for some reason we'll pick one over the other, but and we can kind of get into each one individually, but they're kind of the main modalities we would use here for imaging.
And you mentioned nuclear scintigraphy, and I feel like that is, certainly something that we've relied on a great deal for the depth of imaging that you're looking for. So is there a comparison then as you think about the mile pet imaging? Dr. Coleridge, explain that to us, and what would be the comparison with nuclear scintigraphy?
I suppose the nuclear scintigraphy, the bone scan's really handy because you can image the entire horse. We give the horse an injection of an isotope, and then a camera picks up that isotope from its bones all over the animal. And so if there's a few things going on in a horse, or oftentimes racehorse screening after they've been on a break, bone scan's a very good place to start. And it can often identify an area of concern, and then we can use more focused imaging like radiographs, or now the PET scan, to focus in on a fetlock or a knee or something like that.
So the opportunity for the PET scan seems really exciting. So tell us more about exactly what that is.
So the PET scan is basically a high-end bone scan. So the PET scan is a 3D bone scan. So with a typical bone scan, you inject the horse and you use a flat camera to pick up. So it's a two-dimensional image you're going to look at. The difference with the PET scan, and a lot of this work came from Dr. Spurey, UC Davis. Yes. He was really the pioneer of this, and David from the Milne Pet that invented the machine. So we started talking to them a couple of years ago, and really what it is a circular machine that'll pick up a 3D image. So it's going to give us a lot more in-depth of that area it's going to scan. I mean, the limitations are it's a circle, so it can only do a certain parts of the horse. It can't get up. Sometimes you can get knees and hocks, but that's as high as you can go. So it is limited to distal limb, but the good thing is, 99% of lamenesses are distal limb in racehorses. So
right.
What it is, it's giving us a lot more information than the traditional bone scan. And we use it a lot, not only for early detection or detecting the lameness. It's more of a, when can you bring this horse back to training? It's had 90 days off. Let's do a PET scan to make sure that what we saw before is now gone or reduced, or we would feel comfortable putting it back in training. So that's something a bone scan really can't do for us, because it's higher sensitivity on the PET scan for sure.
So that 3D imaging is really what's allowing you kind of
Absolutely,
that level of specificity.
Absolutely.
And then what about safety? I think that's always the first question that I have when we want to talk about, especially athletes, our performance horses. What about safety?
So, from a safety point of view, yes. It's been groundbreaking.
Yeah.
I think in the last couple of years, and the numbers back it up, from Santa Anita to Churchill to the amount of scans. Really, at Santa Anita they started this, and they're way ahead of the amount of scans they've done, and they're seeing it in racetrack fatalities. They're less because of the access to diagnostic tools like this to be able to either predict some oncoming lamenesses or oncoming fractures, or allow people to give horses more time if they need it.
Yes.
When sometimes previously horses were getting 90 days, 120 days, and they're going back into training. And at the end of the day, you were kind of just guessing that they were okay because they look good jogging. But now that we're able to put those back in a PET scan and still see that area as an area of concern and recommend another 60 days or 90 days, it's really groundbreaking of what we weren't able to do before.
Or the opposite, wouldn't you say? So you could scan it and then realize that you're ahead of the curve and get the horse back to training
on
sooner.
average, it's 45. Sometimes it's 45 days. Sometimes it's 245 days. You just don't know when that horse is going to respond. And they've done lots of studies in California based on that, and it can range anywhere in that range.
Yeah. Being able to predict an outcome, I think oftentimes we don't think about being able to manage treatment. Right.
Sure.
So if we can avoid treatment by managing a better outcome, that's ultimately the goal.
Yeah, and we find even with some of the trainers I'm working with now that they're preemptively doing PET scans just to make sure they're okay. Coming into the busy season or they have to increase their workload, they're actually using it now as a tool in training. For safety reasons, for the right reasons, and it's a massive tool for trainers to have.
So is it primarily being used in the thoroughbred industry?
Yes, primarily for me, and most of my practice is thoroughbred industry. There are some cases of sport horses for sure, but for my practice, it's mainly thoroughbreds. Yeah.
Right. So, and I would suspect that moving forward, it will be used in sport horses more, as we've seen with some of the other modalities in the past, right? But
yeah, I'm sure Matt can comment on CT and MRI.
Yeah.
Also,
I think it's just another useful modality to have. If you've got a horse where you know where the area of lameness is or pain is, but you can't image it on standard radiographs, then all of these modalities come into their own. So, and we can do them all standing now. So we can do the MRI standing, so the horse is no general anesthesia for that. The same for the PET scan. So it just opens up our options to further delve into what the problem might be. And so, once we have an answer, then we can figure out a treatment. But before having a diagnosis, we're just guessing.
yes. So the importance of diagnostics, that really brings up how important that is. So talk to us. In today's world, it's almost becoming an expectation of our clients that we have these options available when it comes to diagnostics. What is the importance of diagnostics with today's equine athlete especially?
Oh, it's paramount, absolutely. Unless you have the diagnosis, you've no plan going forward for the animal, for the client. Everybody wants to know what the problem is, what the prognosis is. So the more information we can get, the better. We need that. We need the diagnosis so we can enact a treatment plan. And the quicker we can do that, often you get those horses back faster knowing that.
Right. And again, the safety, of
Sure.
the horse being paramount, right,
Yeah.
in what everyone is doing. And so the diagnostics offerings that are here, certainly we're going to talk about the Mile Pet today, but give just a run through. You've mentioned a few. When you have clients that are interested in care at Hagyard Equine, there is a long list of diagnostics that is, able to be provided here. Can you run us through a list of those? Do we have enough time for that, Dr. Orr?
Well, I think we've mentioned most of them already. Starting with from the radiographs to the PET scan to the bone scan to the CT and the standing MRI, and we have a knockdown MRI as well. So they're the main diagnostics we have on offer.
And we just got a GA CT
Yeah.
for fracture repair as well.
Okay.
So yeah, we're pushing the envelope on making sure we're at the top end of diagnostic capabilities.
Yes. And that's what, I wanted our listeners to be able to hear that, right? That there is no shortage of options and opportunities here, and it really is best medicine. That what you're looking for is how do we best take care of the
I think
patients.
that's right. And I think as a practitioner now, you want the best tools when you're practicing medicine. We want to be the Cleveland Clinics and the Mayo Clinics of the horse world. So we have to have those tools, to attract good talent, to attract good vets here that want to come and work here and work on good horses with the best equipment. You have to provide all those services here.
Standard of excellence is high. So let's talk about the Mile Pet. This is not something that they're going to find at just every clinic in the world. So there are very few of them, as I understand, in the United States. And that has made, a competitive advantage here for Hagyard. So let's talk a little bit about where it is and how it works and who it's for.
Right. So we started this project with providing services at Churchill Downs. So on the backside, we teamed up with Churchill to utilize some space they had for diagnostic imaging. So, we thought it'd be a good idea to bring a PET scan in there and make it available for referring vets and trainers that kind of based themselves at Churchill or in that surrounding area. So that was actually quite very successful. We offered it twice a week. And on those, and now we kind of figured it out and have been using it for some time. We actually, on the other days of the week, we can bring the machine down to Hagyard's here in Lexington and do offer that service here too. So we can bring the machine back and forth, and we can do 3, 4, 5 patients a day.
Okay, wow. So that's really opened up the opportunities between Louisville and Lexington.
Absolutely,
to be providing that service to so many of your clients.
Yeah, and it's a small machine. It's mobile. It fits in the back of the van and can be set up easily. And the horse is done standing, so it's a very quick scan as well. It doesn't take very long to scan the joint in question or joints in question. So as Dr. Hoare said, you can do a lot in a day.
And so what's the power of that partnership with Churchill? Tell me a little bit about what that really brought to the table for Hagyard and for Churchill and our patients and clients.
There was just perfect synergy there for what Churchill were trying to do for their clients and what we were able to provide. Anytime we can increase the infrastructure of services for diagnostic imaging close to a racetrack is going to be better for the horse, better for the trainers, and better outcome for everybody. So, we saw that as an opportunity that was kind of needed close to trainers there. As someone that works at racetracks and sometimes you're in remote areas where there's not much access to good diagnostic imaging outside of an x-ray machine. You're shipping hours away to have a bone scan done. So a lot of times it's not practical to get that done. But, now that we have it, they can literally, finish training and walk the horse across the street and have a PET scan done. It's been very successful.
Yeah, absolutely. And what are some of the misconceptions that you might talk or speak to about diagnostics and their use in and around equine? Are there misconceptions that you think stand out?
I think the big one for me is you hear some people say, well, it doesn't matter what you diagnose it with, you're just going to give it 90 days off anyway. And that was kind of a common theme that, for years. Until now, we're kind of actually seeing, we're diagnosing it properly, we're seeing what the lesion is, and as Matt said, we're coming up with a treatment plan now that can get that horse back into training quicker, or, give it more time that it needs to come back to training to make the overall picture of the horse's life successful to be a racehorse. Because so many times we were bringing them back into training too soon, and then you get back up to breezing again, and then they're not right, and you have to send them back to the farm again. So you're just losing time. But now with proper diagnostics, and proper amount of time off, it's definitely a better scenario.
Improving care.
And we know a lot more about how the bone changes in these athletes as well, and that's hugely important because that synergistically with the PET scan and other diagnostic modalities now, because we can monitor things along, and things like the PET scan you're able to do multiple scans on a horse in its time off, both with how easy it is to do and also with the cost of it. And so now tailoring it to what we, in conjunction with what we know about bone turnover in these horses, that's going to really affect how many of those horses re-injure. There's a lot of horses after a break, for whatever reason, if they get that 90 days, 120 days, if those horses aren't brought back properly, that's often when you get a catastrophic problem. So being able to monitor those injuries along and get the horse back at the right time is hugely important, and PET's really helping us do that.
Any specific misconceptions that you would add about thoroughbred owners and trainers in particular, and the mile pet being at Churchill? Have there been challenges with that you would speak to?
I think there's probably a stereotypical misconception, in my mind anyway, that these so-called expensive machines are kind of bad news machines. So MRI, bone scan, PET scan is the next thing. Is that all they're going to get is bad news? And as Dr. Horse said, then we're just going to say 90 days off or retire the horse. But I think on the flip side of that, you're actually able to get a lot of good news out of the machines. You can diagnose something as not a major problem, or it doesn't need as much time off, and you can monitor it and get that horse back quicker. And as I just mentioned before, I think there's huge advantages to that, both for the client and the trainer, and for the horse. But also we can tailor that return and have less problems on the return, because in my experience, you get so many problems in horses that have already had a break. So they've had a break for some reason, whatever that is, and then it's the return to training after that that's often the issue. I find that horses that manage to stay sound and continue working without breaks tend to have less problems, and that's actually been shown a few times. So.
Okay. And this provides some of the data to support that, certainly. And that's what you have spoken to. Do either of you, or I'll ask both of you, hopefully, have a standout experience using the mile pet or anything else that really proves the point of the power of these types of diagnostics? Any standout experiences or a particular
I've had a couple
patient?
of really cool, interesting cases of, typical lameness, block to the fetlock. You radiograph it, it looks fine. And we do a PET scan, and it lit up in a distal condyle with a hairline fracture. And then we went back to the radiographs, and on a second look, we can make an excuse that, yes, there actually was a little line there that we didn't see initially. So cases like that would have been missed initially. Yeah. The horse was a cool case, ended up having a screw placed in the distal condyle, and came back after 90 days, 120 days, and it's back in training, successful. So. There's a case that would have been missed without the PET scan. Right. I think the other big strength of the PET scan is the inflammation it picks up in the sesamoids, which typically does not happen in bone scan, just because of the poor blood supply to sesamoids. But due to the high sensitivity and 3D imaging of the PET scan, we are now, which we never really saw before, is definitely proximal sesamoids. They come back red hot uptake on the PET scan, which before they x-rayed, and they still x-ray normal, so you'd probably put them back into training too early and they end up possibly breaking their sesamoid, which now we're able to measure that and quantify that over time and know when is the appropriate time to bring them back into training. So wow. For me, that's a huge, yeah.
That's powerful. Yeah. Dr. Coleridge?
Yeah, I suppose the kind of silent fissure fracture is the thing that stands out for me. You'd often x-ray a lame horse, blocks to the fetlock, as Dr. Horse said, and there would be a little line in the region where they usually have a fracture, and then now, and you'd give the horse time off for that, but now we're able to scan these things with PET scan or MRI, and we can tell whether that fissure is active or if it's maybe been there since it was a baby, and it's not really a problem. So on the flip side of having to give it time off, now you can rule that out as a problem, and those horses can go back into training. And I've been involved with cases where, one horse in particular that I know of that was a very good racehorse in the UK, multiple grade 1 winner, would have come in after scans every race. They'd have a scan after every race to make sure that the little fissure that it had since it was a baby was not active. And so it could continue on training, continue on winning. Yeah. So there you're taking an x-ray change, and you're able to rule it out as a problem, and the horse is able to continue competing. Yeah,
and to that point, we're actually using the PET scan sometimes now in pre-purchase exams. That, in a typically pre-purchase, we do radiographs, 36 images, and you write your report off that, and the decision is based on that. And sometimes in these situations, you have, as Matt said, little fissures that you don't know if they've been there since a baby, if they're active, non-active. And now we have confidence by doing a PET scan to say, hey, it's not active, you're okay to buy this horse. So, that's a big change in our daily routine sometimes now, is using the PET scan for pre-purchase. And it's not always practical, and people don't often want to spend the money, but in situations where it's an expensive horse and people want to make a educated decision, it's definitely worth doing.
Yeah. And so do you see that entering the thoroughbred sale world at all?
Well, practicality of that, probably no. But,
right. I had to ask.
Yeah.
That's your world, so we had to ask, right?
Yeah. I mean, that shows the limitations sometimes of doing pre-purchases at sales, on racehorses especially, because a lot of stuff doesn't show up on radiographs that we see on other modalities. And,
right.
It's look at the draw sometimes.
Yes. Well, I had to bring that up because I think our listeners can tell that maybe neither one of you are from here originally, but have a lot of experience not only nationally but internationally in equine veterinary medicine. So you're fairly well schooled on the opportunities that we have not only here but elsewhere.
Yeah, from my working career has pretty much been in the States, but I deal a lot with international clients and international horses, and Matt's been all over the world working in Ireland and England, and now back here. But
I think this is just because of the concentration of animals here, from foals all the way through to racehorses. Kentucky is, a bit of an epicenter because of the number of horses. So you can develop facilities and practices that can afford to, run systems like PET scans and MRIs, and all of this diagnostics is incredibly expensive. So we need a business model that works to go around it to get that stuff available. And because of the numbers here, we're able to do it.
Yeah, without a doubt. So let's speak to that a little bit. You are back here fairly recently. You were an intern at Hagyard a couple of years ago. Yep. You've gained a few letters behind your name.
I thought you were going to say pounds.
Well, I wasn't. I was never going to say that.
Right.
Letters behind your name in your absence, and you have come back here. So speak to your intern experience for those that are considering that. We have a lot of listeners. We like to encourage everyone to come and visit us here in Lexington, Kentucky. Come to Hagyard, and so speak to that experience for us.
I was an intern in 2012, and I had visited the year, 2 years prior to that, 3 years prior to that, perhaps as a student, and this place just blew my mind from the moment I came here, and the internship was one of the best years of my life. I had a great time, learned a lot. It's a very unique place, the way the practice runs, and Lexington itself is a very unique place with regards to the horse industry in the world. So I was delighted to get the opportunity to come back.
And so what would you say to the 10-year-ago you, the student who is listening to this today, who is considering their options and opportunities towards internships, externships, what to do, whether they even want to go to vet school? What are you going to tell them?
I think if you have an interest in equine veterinary medicine, this is one of the places to visit. The sheer volume of cases that come through here and the expertise of the clinicians working here, so much vast experience. You're bound to get something from it. Yeah.
Absolutely. So in the decade or so that you were not here at Hagyard, were you surprised to come back at the number of sport horses in the practice today versus 10 years ago? Some of those things. What has changed that you've seen most noticeably?
Yeah, I think the sport horse caseload has increased, but also as has our sport horse department and the performance horse department and the vets. The number of vets is more than when I was an intern. The practice is growing, and servicing the huge industry there is here. I think even just driving around, there seems a lot more sport horse farms than there used to be as well. So that's great for us.
Yeah, speaks to the power of the industry. Yes. Well, gentlemen, as we wrap up, what else do you want to add for our listeners? Is there anything else that you would mention speaking to diagnostics or opportunities here at Hagyard around diagnostics?
I think there's not many practices in the world that have the array of diagnostics that we have here, and getting the experience of getting a bit of exposure to all of those modalities here is certainly a great experience.
Yeah, I agree. I mean, for the volume of horses that come through here, the amount of modalities we have, it's a steep learning curve when you start, but it's a great journey.
And then speak to your potential clients. What would you say to a client that is out there that hasn't yet experienced Hagyard Equine Medical Institute and they have thoroughbreds or sport horses? What would you say to them as it relates to your abilities here for their performance athlete?
I think there's just a great team of people here working together. I think that there's an expert in every facet of a horse's problem here, and I think we pride ourselves on working together as a team for the client, for the horse, and as a result, feel like we get very good results doing that.
Totally agree.
What he said?
Yeah.
Okay. Well, gentlemen, thank you so much for being here today, for sharing your expertise and helping us better understand the power and the value of diagnostics, and specifically the Mile PET scan, which is now available through Hagyard, both in Louisville at Churchill and here in Lexington at Hagyard Equine Medical. So listeners, we will encourage you to head to the website at hagyard.com and plan your visit. Come see us. So whether you are an intern or an extern or a student, or you are interested in this industry and would love to have a tour, get that tour scheduled and come see us. So with that, the spirit of Hagyard, thank you all, and we'll see you back here for our next episode. Cheers. Well, thank you both, Dr. Michael Hoare, Dr. Matt Coleridge, for an incredible episode of The Spirit of Hagyard. We appreciate your time so much.
Thank you. It was great.
Yeah, thanks for having me. Appreciate it.